Hey everyone, we're going to get started here in a few minutes. So yeah, just sit back and I'll get back to y'all in a few minutes. Good afternoon, everyone. I'm Laurel Aragona from Pseudocol Labs in the APTO Body Art Committee, and we would like to thank you for joining us for the APTO Professional Development Series. We are here today for body art and COVID. Your questions answered by regulators, and our panelists are Catherine Martinez from Kent County, Michigan, Candace Krushmer from Ventura County, California, Mike Lipinski from Franklin County, Ohio, Jody Zimmerman from El Paso County, Colorado, and Stacy Evangeline from Montana. We will be taking questions towards the middle and end of the webinar, so please feel free to hold on to your questions, or you can type them into the questions box during the presentation. And we will read the questions submitted during the webinar out at the end, as well as open up the phone line. And this webinar is being recorded and will be available by next week. All right, so to get started, our first question is, what PPE are you seeing artists wearing, and do you feel that they should be wearing more? And I'll go ahead and start with Jody.
All right. So interestingly enough, we're in the middle of switching to virtual inspections. But while we have been out in the field, we've actually had several new facilities open over the past months. And the rules here in Colorado are that everybody's required to wear a mask, clients and artists. And if you are doing any sort of a facial piercing where your client has to remove their mask, they are also required to wear a face shield. And the client must wear the mask up until the time of the procedure. They may remove the mask for the procedure and then must replace the mask when done.
Great. Mike, what about what you're seeing in Ohio? You're muted.
I've been seeing a lot of like the neck gaiters being wore, and mostly N95 masks, and just the regular like surgical masks being worn. I have a few operators that have used face shields as well.
Candy?
Well, so in California, we have the Safe Body Art Act, and they are required to wear disposable gloves, an apron, bib, or lap pad for their PPE. With COVID and the state guidance, they require the operators to wear a mask or a face covering is how they define it. When I was in the field, I did see the operators wearing a mask. It wasn't covering their face, and we did some education, but for the most part, they had all their PPE that's required by law and in the guidance. They also had.
Great. Stacy?
Same as everyone else, we're requiring masks for COVID. I've had one artist who was actually wearing scrubs and treating them as they were contaminated. So they would put those on when they got to work and take them off before they got home. They told me they had a family member who was immunocompromised, so they were doing that. And not PPE, but what I found interesting is we have 2 shops here in town that have installed UV lights in their shop as part of fighting COVID.
Interesting. And Catherine, what about you?
In Michigan, in addition to the already required PPE, we were in a situation similar to Jody's, where if the client had to remove their face mask, then the artist had to put on, in addition to their face mask, a face shield. However, this week it changed so that no procedures are allowed that require the client to remove their face mask.
All right. Next questions are you seeing artists shortening time spent with clients in one session? For example, if the tattoo takes 4 hours, are they performing that in one session or breaking it into multiple sessions? Or is that even something that you guys are aware of? Start with Mike.
Usually when I'm usually not privy to that. I don't see. But what I have been finding is a lot of my operators are doing appointment only. So not all of them, but whereas you have to call to set up an appointment, so that way you're not getting a lot of walk-ins or crowds in the waiting areas. But I haven't heard any operators mentioning shortening the time though. But like I said, they may be, and I just may not be aware of it.
All right. Candace, what about you?
Well, in the guidance from the state, it does indicate to minimize the amount of time spent within a 6-foot area of the customers, but I have not spoken to the operators regarding tattoos that may be 4 hours long and shortening it to 1 hour. It does sound like a good idea, though.
Stacey, what about you?
When we got these questions, I actually sent them out to some of my artists here. One guy responded that he was breaking his sessions up into multiple sessions, particularly if they were doing something like chest tattoos or something close to the face. In our recommendations, we recommended not to do face tattoos, and he didn't address that, but he said if it was close to the face, he was breaking it up into smaller sessions. Someone else responded to me that no, they weren't, because to them that seemed counterproductive. If they're doing multiple short sessions, that's more people they're being exposed to. So having one client in for one long session that day, that was minimizing their risk, which makes sense to me. I agree with that reasoning.
Catherine.
We have not been permitted to go out into the field recently. I don't know if we're going to be able to anytime soon. However, I do know that they were the artists that were in larger shops were being good about scheduling, so that way they only would have kind of every other booth filled, and then they were being very conscious of the times that they were spending with their clients and trying to keep it to the smaller procedures.
All right, and Jody.
Yeah, so I'm pretty immersed in our body art community here on several levels, and I feel like as to what Mike was saying, we're not allowing walk-ins at all. So there's not allowed to be extra people. Nobody's allowed to be sitting in the lobbies. Most of my shops, I wouldn't say most, I think it's about 50-50 right now, are actually locking their doors. And if an artist happens to be available, they're calling to, like, you know, we're trying to maximize business here while promoting and protecting public health. So a lot of people are having their number on the door or something like that. And then if they have available time, I've even seen where people are giving numbers, like piercing places that are more in and out more quickly, giving numbers, having clients wait in their cars until it's their turn, and just keeping it very one-on-one. Aside from that, honestly, I agree with what your artist said, Stacy, is that I don't think, you know, so my whole family is recovering from COVID right now. And the doctor in the urgent care told us that as they were dealing with people with positive cases, they were only allowed to spend 10 minutes. So I kind of feel like once you've spent 10 or 15 minutes, at that point, the exposure is there. And to me, I think probably just knocking it out and getting it out of the way at one time would be less risky, honestly.
I have had a lot of my operators also to say they're taking more breaks, like breaking it up a little bit, you know, whether it be like a water break or.
All right, great. Thanks, guys. Our next question is, how did your jurisdiction decide that it was okay or wasn't okay for body art studios to open? And I'll start with Stacy.
So I sent a couple documents to Amy to attach, and one of them is this. This is the state of Montana, our phased reopening guidance. So the way it worked here in Montana, our governor issued a stay-at-home order like the end of March, beginning of April. And in that stay-at-home order, our body art establishments were closed. As soon as that was lifted, those establishments were able to start reopening in phases. So you're not going to be able to see this, but like I said, it would be attached. So they had phase 1, phase 2, phase 3. And some of the things we said, like appointments only, were happening in phase 1. So I guess body arts weren't specifically addressed as when are we reopening those. It was just everything was shut down, and then we're opening everything back up.
Right. Candace?
California was similar. So the governor on March 19th issued an executive order, and then each county, or there were several counties that also issued public health orders with their own guidelines and requirements. With my county, it wasn't parallel with the governor's order, so we did adjust it. There was a lot of fluidity during this time. The state did have a website, and it was called the Resilience Roadmap, and they were starting to reopen in phases. So once the shutdown occurred, then they slowly started to reopen different industries. And unfortunately, body art was one of the last industries to get to reopen. Since then, they've evolved and changed, and now we're in a blueprint to a safer economy. And that's where each county is in a tier 1, 2, or it's purple, red, I think yellow, and I'm not sure because my county has never gotten past red. And with that, different industries were able to open at different capacities with different requirements. And with body art, It, again, was one of the last to get to open. And there's just been a lot of change. And at this time, body art is able to be open at any tier, and purple is the most restricted tier with restrictions.
Catherine?
We had a very similar setup in Michigan when the reopenings occurred, where the state was broken up into certain areas, and those areas all of them were opened up in phases based on the infection rate. So if it as it decreased, they would move to a new phase, and within each phase there were groups of different industries that were able to open, and it was just the lump that body art had been in with it. It was along with several others, and it was in one of the earlier phases as well.
All right, Jody?
Okay, so as far as Colorado, we shut down. Our quarantine started March 25th, and that's when everybody was in stay at home. Our body art facilities here are classified as a personal service, so they're in the same category as beauty salons or nail salons or spas, things like that. So starting on May 18th, they were allowed to reopen with some of the restrictions I mentioned earlier. The masks and the face shield. Well, at the beginning, you weren't allowed to remove the mask at all. So as our numbers, the face shield and the mask for piercing. So at the beginning, you weren't allowed to do any piercings that required removal of the client's mask. Then as numbers went down a little bit, we did allow the piercers to start doing the piercings where you were removing the mask. Now we are at the point where, and then it was 10 people total. So that was 5 artists, 5 clients maximum. Now we have moved up to, it's either 25% occupancy or 25 people per room, whichever is less. We only have a few huge shops here. A lot of them are 1 or 2 people. But ours sounds pretty similar to yours, Candace, where we are now in all the colors. So there is blue, green, yellow, orange, red, and purple. My county right now is on the verge of red, and purple would be where all personal services have to close again, unfortunately.
All right, and Mike?
We've followed the governor's safe restart document that he came out with. Body arts, they were allowed to open, I believe it was like June, early summer. But up until like 3 weeks ago, they still were not allowed to do facial piercings and tattoos. So that has just recently been allowed. It'll be interesting because we just turned purple as of today. So I guess we're kind of on a wait and see what's going on. We haven't heard of any changes yet, but we have strictly followed what the governor's orders have been.
All right, great. Thanks, guys. Our next question is, and part of this has been addressed already, but are artists shying away from the face, upper arm, or chest area, or are they taking extra precautions? I know that we've talked some about the face, but not so much about upper arm and chest. So we'll start with Catherine this time.
Not that I am aware of. Like I said previously, we have not had the ability to get out and really interact and have these conversations with our artists. But I believe that with all of the current PPE requirements, they are not shying away from those certain areas of the upper arm and chest.
All right. Stacy.
When we issued our phased reopenings, we did what was required, and then we also listed best practices. So under best practices, we recommended that they avoid doing any tattoos or piercings that would require the customer to remove their face covering. And from what I've seen and kind of heard, it seems like most people are avoiding those right now. But like I said, that's up to the artist to decide if they want to take that risk. And the only real feedback I got from that was the person who told me they were breaking up any tattoos in the upper chest area into smaller sessions.
Mike.
I agree with Stacy on this one. When we found out the questions, I passed them along to some of my artists as well, and their response was just, it depends on the particular artist whether they do it. But most, I haven't heard of any of them shying away, at least the ones that I talk to.
All right, Jody.
Yeah, I agree. I'm in a pretty similar situation here. I think, I do have a handful of artists that sound like you're one artist, Stacy, that are going above and beyond. I had one of my piercing shops, even when we allowed reopening, he still waited a few extra weeks just to see what was going to happen. And when we allowed the removal of the face masks, he still waited. I don't think he is even still doing facial piercing. So I think it varies a whole lot from shop to shop. But honestly, for the most part, I feel like most of our shops are doing a pretty good job following the rules. I have a small handful of people that are not. But I don't think it has impacted at all anybody's, no matter where they are, aside from that one with the facial piercings. I don't think it has impacted where they are tattooing on the body. I think exposure is exposure.
All right, and Candace.
I have a similar answer. So at this time, they're not supposed to be tattooing anywhere around where their mask is located at. I don't think that they're shying away from their chest or arms, but it is dependent on that individual artist and their comfort levels and what PPE they may have, because you can have all the masks and gloves, but some of them have air purification systems and others have UV lights to help with sanitation.
All right, great. Our next question isn't so much COVID related, but it still pertains. So it says our state code and therefore our county code requires an absorbent bandage to be placed over a tattoo after the completion of the tattoo process. A lot of artists in the county have variances and use other products instead, like Tegaderm or Saniderm. For the health and safety of the client, which method do you think is best, and what are the requirements in your area? Start with Candace.
I'd love to know what state this was from. Will you be able to
I'm not
provide me
sure.
that?
Were they
No?
from Montana? Because that's in our rules, and that's been like an ongoing issue. So I'm wondering if the question came from Montana.
I'm not sure where the question came from.
Okay, well, in California, the Safe Body Art Act does require at the temporary body art facilities to have absorbent dressings for the artist to purchase. And then in the code, it says that when covering a procedure site, use a sterile dressing. We are trying to submit amendments to make changes to the Safe Body Art Act, and this is a section that we are trying to make those changes to include other types of covering, such as the Tegaderm and different items used in the tattoo industry.
All right, Catherine.
In Michigan, I guess that's all I can speak for. I have a personal opinion, but not a medically professional opinion on bandages. But we only say what you can't use. Actually, you cannot use a food grade plastic wrap, and you cannot use any kind of tape that isn't medical grade tape. So those are our only limitations. I will say that a lot of traditional tattoos, not permanent cosmetics, the majority of them are using a type of barrier similar to Saniderm and Tegaderm.
All right, Jody.
Catherine, I'm so glad that you just said that, because I think it's a good thing to throw out there just in case everybody that's listening doesn't know. Like, it varies so much what we regulate from state to state too. Permanent cosmetics, microblading, things like that are not under my jurisdiction in Colorado, so I don't regulate that at all. Interestingly enough. But as far as my facilities and my code here, we do require that the client leaves the shop with some sort of covering. That can be food grade plastic wrap and tape. That can be the absorbent, they like to call them the meat packs. I have a significant portion of my facilities using Saniderm and Tegaderm. As far as safety of the client, I've definitely talked to a lot of artists that state that they have seen some allergic reactions as far as Saniderm and Tegaderm. I do require 2 separate aftercare forms if they're going to use both, because the aftercare is very different with a Saniderm or a Tegaderm versus any other type of bandaging. But I see it all. So yeah, and like Catherine said, I definitely have personal opinions and preferences for what I do when I get tattooed, but I think it depends on the artist. I think it depends on the client, and honestly, I think it depends on the client-artist relationship. Like, I think there's a lot of great things about Saniderm and Tegaderm. I think it's wonderful if you have a client who, I have some people that send them home with an extra piece and tell them to change it out within 24 hours. I have some people that think it's terrible and don't want to use it. I've also had to correct a few people that were advising their clients to use it improperly, because the idea of Saniderm or Tegaderm is to create a watertight like seal or barrier, and once that seal is broken, it's no longer safe and can trap in bacteria. So it's definitely all over the place.
All right, Mike.
Yeah, my answer is similar to Jody's. We in the Ohio code, they stipulate that the artist has to verbally give them aftercare instructions, and they have to give them a paper to walk out the door with. And I have most of my artists, they pack up, and even my permanent cosmetic artists, they have like their own sample little aftercare pack that they give the customer, and then a lot follow up within a couple days, because they look at it as they can't control it once the person leaves the shop, but it is their artwork and they care about it, so they try to follow up as much as they can after the procedure. So it's kind of similar to like what Jody said.
All right, and Stacy.
So I feel like I should clarify that the rule that you need the absorbent bandage predates my time here. So yeah, we are looking into changing that. The rules were probably going to be rewritten this year, and then COVID happened. So anything like that was on the table got pushed back. But if the person who asked this is wondering, that will likely change. In Montana, we do regulate permanent cosmetics as part of tattooing. And as you can imagine, if someone's doing microblading or permanent eyeliner, they can't put an absorbent bandage over that. And right now, the way the rule's written, that is the requirement. As far as which one's better, the Tegaderm or Saniderm, I'm not going to answer that because I don't know. I think that's, artist's preference.
All right, thanks, guys. Next question is, has there been a confirmed case of COVID spread between an artist and a client, or vice versa, in your jurisdiction? And I will start with Jody.
So we have had a few confirmed cases that have, you know, as we're doing the contact tracing, that have been tattooed during their period of, you know, as far as we're doing contact tracing a few days back before symptoms, and there have been people that have gotten tattooed while they were asymptomatic or something like that. I did have a few artists that had to quarantine because they came in contact, but I don't know for sure of anyone, any artist that actually got exposed and got it from a client.
I guess, sorry, I should have added this on the end of the question. For if there was a confirmed case, so like you said that in Colorado there was, how did your department respond?
So, I mean, you know, and the other thing I think I'd like to add, I have a lot of professional and personal opinions about all of this, actually. I think, you know, the problem is contact tracing only works if people are honest about where they have been and who they have come into contact with. And my honest fear is that a lot of people that, well, first of all, right now we're so inundated in cases. My county is currently at a 15% positivity rate. We're so inundated at this moment in time that we can't contact trace with everybody, so it's impossible. But contact tracing only works if people are honest. And my fear is there's been more of it in the body art community that has been reported. But I don't know because there's no way to prove that or not. But we do, that's what we recommend. If we have a client that tests positive that says that they did get tattooed at one of our facilities, we contact the shop, we advise them to disinfect, and we ask the artist or anyone that might have been within 6 feet of that client to quarantine for 14 days.
Right, Catherine.
We have not been notified of any cases that have been associated with a facility, whether it would be an artist with a positive patient that they, or a positive client that they came in contact with, or whether it was an artist that had to quarantine or did test positive. I'm not 100% sure if that's something that they would pass on to us with contact tracing. We've been beyond overwhelmed with it. However, I know in the past with other types of industry, they do relay that information on, but to my knowledge, we haven't had any relation.
All right, Stacy.
So I ran some of these questions by our bigger county health departments, and Missoula County did say they did have one body art studio that had to be closed down, and the people who worked there were notified by contact tracing that they were positive, and then they notified the county regulators about that, so they were on top of it, quarantining and cleaning. Another thing that I included for Amy to attach to this presentation is Missoula County's the response they hand out to their establishments on how they need to respond when they have a positive case. And they said that the one establishment they had that did have that, they did everything they needed to do.
All right, Candace.
In Ventura County, we haven't had any to my knowledge. Within the state of California, I'm not positive. We did recently have a body art TAC meeting, and I don't recall that being brought up or anybody expressing that concern.
Okay, and Mike.
Not that I'm aware of. Like Jody said, we're in Franklin County, we're far behind on contact tracing, but we work real closely with our epidemiologists, and usually if they get word, they'll come to my supervisors and talk with us, and we handle the situation. But I haven't, not to my knowledge, have we had any COVID outbreaks. I did have an artist that called inquiring, wanted to know what to do. He had a worker that was COVID. He hadn't been in the shop for a while, but he wanted to know, precautions, what to do. They had already cleaned and sterilized the studio, but he just wanted to know, when when to send the person back. So then when it gets to be like nursing questions or medical questions, I'll refer them either to one of our nursing division personnel or our epidemiologists. But I don't know, being in Franklin County, there's our health department and City of Columbus Health Department. So I can't speak for City of Columbus, I'm not sure, but at Franklin County, we haven't.
All right. Next question is, what is the best way for industry to interact with their licensing office or regulatory office about trying to reopen? And I'll start with Stacy.
So I actually work at the state level, not the county level. I do some inspections here in our county and some of the other ones that opt out of it. But at the beginning of the pandemic, everything, as you know, was kind of nuts. And I did have some people reach out to me because, you know, my number was the number on their licensing paperwork. And unfortunately, the way things were moving, the counties had the ability to make their own rules, you know, at the county level, and the state had different rules. So I had a couple instances where people reached out to me, asked me a question, and I gave them the answer that was appropriate for the state, but not appropriate for their county. So I was giving them incorrect information. So really the best thing to do is to reach out to your county health department. And one of the things I do for the people I inspect, I make sure at the end of the inspection that I hand them a business card, and that will give them my direct line here at work so they can call me. So hopefully you have that information for your inspector so you can reach out to them directly, which would be quicker. I also had people, as it went on, calling me saying that they weren't able to get through to their health department because they were calling the main number. They were leaving a message and no one was getting back to them. So again, that would go back to hopefully having that relationship established with the people you're inspecting, that they have your personal contact information and can reach out to you if they need to.
Mike.
Exactly what Stacy said. We have our county. We have like 77 operations, and that includes permanent cosmetic, microblading, and tattoo. But I would just tell people, you know, get to know your inspector and contact them. I make sure all my artists have my number, and you know, we check voicemail constantly. So if I don't get back with you within that day, it'll be the next day. But just get to know your regulator would be my recommendation.
All right, Jody.
Yeah, I agree 100%. I do my job a little differently than a lot of regulators do, and I try to stay really close with I do mostly body art, and I do a lot of retail food as well. I try really hard to keep really good rapport and good relationships with all of my facilities, and that way when we are in these types of situations, you know, they're comfortable reaching out to me. Interestingly, to Stacy, as to what you said, so body art's an optional program in Colorado. We have lots of counties that don't regulate facilities at all. And I think that, and honestly, there's not a state body art person. So for sure in Colorado, the advice that I would give would be to try to, and the same thing, like both you guys said, unfortunately, like you can't call the health department, nobody's there. You can leave messages on the COVID line, but then you're in the middle of 8,000 messages and you get, you know, pushed aside. So reaching out to I would think your specific inspector is probably the easiest way to get the fastest answers.
I try to tell my people that if I don't know the answer, I'll usually have some connections to people like Stacy where I can get the answer for you. So.
All right, Catherine.
I'm local. I'm at the county level, but the state is the one who handles all of the main licensure. we just do inspections at the local level. But I've worked along with my team very hard to get a great relationship with all of our artists, and I have had many of them reach out to me asking for help and questions throughout this process. And my suggestion is, again, just work on your relationship with your local regulators, because I'm not the one who has any control over the opening and closing, but I am willing to help guide the artists on to who they should be speaking to, or any other direction regarding their questions or concerns. So if I can't answer it, I'll find someone who can hopefully help them with it.
And Candace.
Well, if I understand this question correctly, it sounds like they're referring to COVID-19 and getting to reopen. For me and my department, I regulate the Safe Body Art Act, or I use the Safe Body Art Act. The public health order and that executive order were issued by the governor. They weren't issued from my department. They're not a part of the Safe Body Art Act. And so in regards to that, it wasn't my order, or it wasn't our order that we created. So with the state, it was up to them on how they wanted to implement this and how they wanted to reopen California. We didn't really have very much of a voice. It wasn't our order. It was public health. And then even within my individual county, we did have a public health order, but that's within public health, not environmental health. And so my department, environmental health, is the agency that oversees and ensures that the Safe Body Art Act is being followed. And within other counties within the state, it's either under public health, or it's under the county environmental health, or it's under a city's jurisdiction. So it's kind of different across the board. I don't know how well I answered that question, but it's a little complicated.
All right, thanks, guys. The next question is, what could have been done differently to enable for body art studios to open quicker during the COVID-19? And I guess I know that we've talked about this some already, but like, is there anything that body artists could do to show their regulatory offices or licensing offices that they can perform safely? I think that that's what this question was asking. So I'll start with Catherine.
I at no point have had a concern or a question about the shops in my area's ability to operate safely during COVID. They're always operating in a way to protect themselves and their clients best from infections and pathogens. And I wish that there was some magic thing that they could do to, have them be able to reopen when they're ready. But not only is it not something that I have any control over at my level, but I don't think it's a question of them being able to operate safely. I think it's that they are considered to be a higher risk industry because of the close contact that they have with their clients. And I know for Michigan, that seems to be why they get lumped in with the other groups of the reopening phases that they do.
All right, Candace.
Again, it was a public health order, so I don't have a fantastic answer for you. Within the state of California, it's just been very fluid and changing. And then with each county can have their own ordinance and those requirements that they're wanting. So it's not necessarily straight across the board all the same.
All right, Stacy.
Our body art shops here were closed down less than a month, and the only time they were closed down is when the stay-at-home order was in place. So I don't think there's anything individual shops could have done to open sooner. It was a statewide order that affected everyone, and the state opened them, you know, along with everything else. No, there wasn't anything they could have done to open quicker here.
All right, Mike.
Yeah, that's the way Ohio was. Our order was a state order given out by the governor. So there wasn't really anything we could do at the county level. After talking with some of my supervisors, my understanding one of the reasons it took the body art facilities to get open, why it took longer to get open, was their restart plan wasn't as strong as like the cosmetology and like the fitness centers. Those opened maybe like half a month before body art did. Because in Ohio, body art's separate from the Board of Cosmetology. So that is what the rumors are, is one of the holdups from getting the tattoo shops open earlier was that.
All right, and Jody.
Well, I agree absolutely with everything everybody else said. However, I think this is just an example of a little bit of a bigger problem that those of us that are working together on the model body art code are also addressing. Body art is all over the place, all over the United States. And as you have heard just from talking to us today, just COVID wise, some people regulated through the Department of Cosmetology, some people it's an optional, like it is in Colorado, depending on what county you're in. You know, some people it is regulated by your health department, and sometimes it includes microblading and permanent cosmetics, and sometimes it doesn't. So, you know, obviously pandemics aren't planned, and I feel like government workers have done the best that they can to try to balance and take calculated risks and try to promote and protect public health and safety while paying attention to the economic toll that it's taken on our communities, and have done the best to safely reopen facilities as quickly as possible. But I do think that some of the things that we are working on and working together maybe towards, you know, coming up with better plans for the future so that there's more consistency across the board, and then maybe we wouldn't be experiencing so many of these discrepancies.
Mm-hmm.
All right, thanks. And just to let the audience know, we have 4 more questions. So if you want to start submitting questions, that would be great. Or get your questions ready, and you can ask by raising your hand when we say so. But so just for a heads up. So our next question, kind of along the same lines of why were hair salons allowed to open before body art studios? And I'll start with Mike because you were kind of talking about it already a little bit.
Yeah, that is what I heard, you know, and I'm just the inspector, I'm not privy to a lot of that information, but that's what my supervisor heard, that the restart plan that the body art lobbyists and community put together, I guess, wasn't as strong as the Department of Cosmetology and fitness centers and all that, because like I said before, all that goes to the governor's office, and then his people are the ones that set the dates and approve the openings.
All right. I'll go to Candace.
Well, curious which state this was from, this question, but in California, yes, they were able to start doing hair activity prior to body art, but one kind of snafu was with these this group that body art was included in, is that the Safe Body Art Act requires the operators to operate inside an approved enclosed facility. And with the guidance was saying that they can be open, but they have to have their operations outside. So it conflicted with the Safe Body Art Act. So therefore, a number of industries were able to open up and provide these services outside, but our practitioners had to stay closed because they aren't allowed to operate outside. They must be inside their permitted body art facility.
All right. Stacy.
So that's not a true statement. For Montana, they were allowed to open at the same time. Like I mentioned before, local jurisdictions could make their own rules, so it could be possible that some counties in Montana kept them closed longer, but on the statewide, body art and hair salons opened at the same time.
All right, Jody.
So I think this is totally relative to what I just said for the last question too. It's all about how you're classified. I think if you are classified as a personal service here, like we were, they all opened at the same time. So I am very hopeful that through all of the work and effort that so many of us are putting in to try to get everybody on the same page nationwide, and what we're learning through this pandemic, right? This is unprecedented times for all of us, industry and regulatory, and we're all doing the best we can. So hopefully we will do kind of hot washes after we're through all of this, when this is over, right? And we're gonna work together to come up with plans and be more prepared in case this ever happens again, in conjunction with what we're doing to work on the code and to hopefully have at some point, I'm an idealist, so it's easy for me to say this, but hopefully at some point have the ability to have the same rules and regulations across the United States. I think both of those things will really help us. Hopefully we'll never be in this position again, but I think those are two things to look forward to.
All right, and Catherine.
Hi, so I honestly, I'm not involved, like I said, in any of the decision making, but body art was lumped in with salons in our phased reopening. And I don't have any knowledge as to why that occurred.
All right. Our next question is, in Florida, there was an emergency order which prevented our regulator from talking to the governor's office about allowing body art studios to reopen because we fell into the land of administrative oversight. Did this happen in your jurisdiction, and how can we prevent this problem in the future? I'll start with Jody.
Laura, will you read that one more time?
Yeah. So in Florida, there was an emergency order which prevented our regulator from talking to the governor's office about allowing body art studios to reopen because we fell into the land of administrative oversight. Did this happen in your jurisdiction? How can we prevent this problem in the future?
Boy, is that a tough, sticky question. I'm going to default to what I said last time. I really think that, nobody knew what was going to happen or how to best handle this. And I don't think any of our local health, I believe our governor just talks with the state health department. So I mean, maybe, like I said, in Colorado, there is not a state body art person. I hope that being able to go through this and learning what we're learning and maybe coming up with some plans and ideas for how to handle similar situations in the future and continuing to work on more standard legislation that will be utilized across the United States. I would hope that being more proactive and having these tools to utilize in the future will help prevent that from happening.
All right, Stacy.
So, like Jody mentioned, when this pandemic started, no one had planned for this and no one knew what to do. So, at the beginning of the pandemic, there was some confusion here in our state. Our office also regulates restaurants. And there was one instance where we found out about rules for restaurants on the news before our office knew. But that was rectified pretty quick, and my boss started attending weekly meetings with the governor's office task force team. And that was really good for the county regulators as well. So they could get a hold of my boss and my boss could represent them and bring any questions forward. We also have a monthly call our office does with the county health departments. So every month at that call, my boss will remind everyone if they have any questions, they can ask him, and also let everybody know what's going on right there too. So this question's asking about the regulator directly speaking to the governor's office, and I don't think that would be prohibited here, but instead of doing that, we made the different pathway where the counties could talk to this office, and this office was having weekly meetings with the governor's office.
All right. Catherine.
I don't feel like in Michigan we were necessarily prevented by any means, but that decision-making process is so beyond over my head. I mean, it's beyond our even jurisdiction. And I don't even know how much input they were receiving from like the state health departments and the state food regulators either, because in the beginning there were a lot of definition differences in the COVID protocols, acting as if certain things were licensed separately, but they were all under one license. So I think the communication has gotten a lot better. However, it still does not come all the way down to our level at the local health department.
All right, Mike.
Yeah, my answer's along with we couldn't, that decision, I'm not sure that if it happened, it wouldn't surprise me in Ohio, but our health commissioner has been really good about, he would meet with the governor's office, and he's been good about relaying information to us and our communications department that we have would pass all the information to us. So, you know, not to skirt the question, but I guess I'm not really sure.
All right, and Candace.
This example did not happen to us in California that I'm aware of. I don't know how to prevent the problem in the future, but I do know that communication is key.
All right. Next question is, what have you seen that was successful in terms of body art studios reopening during COVID? And I will start with Stacy.
Like I said, we put out our phased reopening. We had the things that were required, things that were recommended. What I'm seeing my body art studios doing is it's all call for appointments. They're not open for walk-in. We required them to shut down their waiting areas. when people go in to get a tattoo, they can bring one person with them. And in our recommendations, we recommended that that be from the same household. So we don't want people, you know, meeting up together to get tattoos. So yeah, just the basic requirements that I think are going to be, you know, similar for all the other states too.
All right, Candace.
Can you rephrase that question?
Yeah, so what have body art studios done successfully in responding to COVID-19?
They've successfully met the guidelines provided by the state. They've successfully obtained the required PPE. And I think they've just successfully worked as a team and a unit to try to help their industry reopen. It's been very detrimental to all our artists. I mean, some practitioners have been closed since March and they didn't get to reopen till October 20th and may still be closed. I'm not sure. It depends on that individual jurisdiction. So it's, you know, it's a very difficult time, and I just have complete empathy for these practitioners.
Jody.
That's why I keep muted, because I'm talking to you guys while you're talking. I feel the same way. It's so hard. You know, it's hard in our positions. I feel like honestly, I'm glad I'm not the one making the decisions. I'm just the one trying to help educate and enforce and things like that. Like, where do you draw that line between public health and business and people being able to feed their families? My heart certainly goes out to everybody that's been impacted. This has been one of the hardest years of my life, for sure. But what I'm seeing that's really successful is, you know, I have a lot of facilities that are taking temperatures, which is not required, but you know, maybe they feel more comfortable and the clients feel more comfortable. I have a lot of facilities that have come up with like a COVID consent form. So they're giving their employees, their clients, the regular consent form that we all require in our jurisdictions, but they're additionally asking them, you know, like the pretty standardized COVID questions. Have you traveled anywhere in the last 14 days? Have you come into contact with anybody that's been an exposure? Have you had any of the following symptoms? Things like that. I think that's been something successful that's been pretty widely implemented. I do think that keeping numbers down, like Stacy was saying too, where we are not allowing any extra people coming in. If it is a minor, a lot of places have stopped tattooing and piercing minors temporarily to reduce the number of people on site. Actually, but if they're going to do a minor, the parent does have to be there. The only other time I'm allowing somebody to come into a facility aside from the client is if it's going to be a back-to-back husband and wife or two roommates, something like that, where they're able to verify addresses to make sure that this is one household to prevent the commingling of people and households. I'm proud of my facilities. For the most part, are doing a fantastic job.
All right, Mike.
Yeah, I agree with Jody. I'm really lucky to have the artists that in the studios I inspect are really good. And if there's any industry or people that, not that anybody was ready for COVID, but they're definitely capable of maintaining a safe facility. They've always been really good from what I've found with using PPE, gloves and all that even before. But I think a lot of places are doing a really good job with, like what Jody said. Some aren't. I don't have a lot that do minors, but the ones that do minors aren't doing it anymore because of that reason. And I've even had a few that have put barriers in between the stations to just like, you know, your generic plexiglass wood barriers for that added security as well. But a lot of them are doing the close like we talked about before, appointment only, and are locking the doors. And I think that's a really good way of preventing the spread also.
Mike, something you said just reminded me of another thing too. I think my good players that have larger shops are absolutely staggering appointments so that you don't have two guys tattooing in the two stations right next to each other either. And I think that's a great way to prevent the spread as well. Yeah.
All right, and Catherine.
Yeah, the facilities that I work with have all taken it incredibly seriously, and they know that if one of them isn't following the protocols, that it is going to set a bad reputation for body art facilities throughout our area, and they all want to stay open, and they all want to make sure that they don't do anything to harm their abilities to stay open. And even before we had changed things to where you're not allowed to remove a mask for a procedure, majority of places, as far as like piercings, weren't doing any kind of nose or oral piercings and any kind of tattoos on the face specifically. And they're also have been going above what the regulations or the protocols for COVID have been. We went through a brief period where there weren't any, and a few months ago, and all of them were still sticking with the previous requirements, and they have been. They all really want to keep everyone safe, and I think we've all said it. We know that the facilities in this industry and the operators know what to do, and they know how to do it, and they're all being very smart about it. And I think that they're all doing exactly what they need to be doing to keep being successful and to stay open.
All right. Our next question is, we have two piercing studios, one in a city that has prohibited under the mask piercing and one in a city without this prohibition. Do you have a sense of the level of risk assumed by the artist with doing under the mask work? Most of the statements from regulators around additional prohibitions focus on eliminating gatherings and not on one-on-one services. I'll start with Candace.
Do I have to answer this?
You don't have to.
I'm gonna pass.
All right.
Could
Mike.
you read that again? I'm sorry, Laura. Could you read that again?
Yeah. So it says we have two piercing studios, one in a city that has prohibited under the mask piercings and one in a city without this prohibition. Do you have a sense of the level of risk assumed by the artist with doing under the mask work? Most of the statements from regulators around additional prohibitions focus on eliminating gatherings and not one-on-one services.
Gosh, that's something I'd feel better referring to like a nurse or a medical professional, I think.
All right, Jody, do you feel comfortable answering this question?
Of course I do. I have opinions about everything, and I'm not a nurse, so let me say that disclaimer. I have a bachelor's in psychology and a master's public health. I've been an environmental health specialist for a very long time. This is what I think. I think it is a little bit individualized for each person that's doing it. I think the artist needs to evaluate their personal health, their family's health. If somebody is immunocompromised, I would assume that would come into play. Like I told you, I have a shop that's piercing only that does not feel comfortable doing that, and that's absolutely their preference to do that. I think the other thing too that comes into play here is contact time. I think that if you're doing a piercing and you're removing a mask on a client, it is probably going to be around that 10-minute contact time that I shared with you that the urgent care doctor said to me. And that's why, like, in the spirit of trying to keep businesses open while keeping people healthy, we have said, hey, you can remove a client's mask to do a facial piercing if you are wearing a mask and a face shield. So we're requiring additional protection. So although I don't know that we can have like a public health stance on that, like Mike said, we're not doctors and nurses and things like that, but those would be the items that I think would come into play making this sort of decision if it is allowed in your jurisdiction.
All right, Stacy, do you feel comfortable answering this question?
So I pulled an actual epidemiologist. Can you ask the question again and see if he can answer?
Yes. We have 2 piercing studios, one in a city that has prohibited under the mask piercing, and one in a city without this prohibition. Do you have a sense of the level of risk assumed by the artist with doing under mask work? Most of the statements from regulators around additional prohibitions focus on eliminating gatherings and not on one-on-one services.
Yep. So I guess what I would say is that if the person is asymptomatic, we would consider them to be not super high risk if your operator is wearing especially like a face shield and an N95 mask, because that's what we would recommend in a healthcare setting for a procedure that would be similar. So when a clinician takes a swab, for instance, from somebody's throat for flu, or I mean, there are some throat swabs for COVID as well. If they have a face shield on, gloves on, and an N95 mask, they're considered protected during that kind of procedure. And then when that procedure's over, the mask goes back on. So I think that, from a medical standpoint, we could argue that that would be very equivalent to what we're seeing in dental offices. That would be equivalent to what we're seeing in medical settings where they take, a similar specimen. I don't know what duration you guys are dealing with. I mean, if I take a throat swab on somebody, that's going to be a fairly short duration. But if you're in a dental chair, as you know, if you've been in a dental chair, that can seem like forever. So I think that you have a range there. The shorter, the better, as far as risk goes. But gloves, mask, face shield, it's hard to say that there's a valid exposure if somebody is suited up to that degree. Does that help?
Yes, and while you were talking, somebody put in a question similar. What about a face shield and only a surgical mask for this type of procedure?
So I guess, we would say that in a medical setting, that would not be sufficient. So in a medical setting, technically that surgical mask is not going to provide the same level of protection as like a KN95 or a N95 mask would. So if there was a clinician that did that with a surgical mask on and a face shield, and his patient ended up being a COVID positive, we'd call that an exposure in that setting. So just trying to equate this with the healthcare approach that we've taken. So a KN95, which is easy to find these days. I was in Albertsons in Helena last night, and there's a rack of them. KN95s, they were 6 for $9. I mean, they're not as hard to find as they were several months ago, when some of this started. So, that simple KN95 mask would be a viable option for folks.
Awesome, thank you.
Okay, thank you.
Catherine, did you have anything to add?
I just want to reiterate, in the question, they said local health jurisdictions or something along those lines, that for, I think, all of us speaking, these are not decisions that are made at our level. And so it's just something to please keep in mind, I think, for most states across the country, that it is not something at our small local level that we're deciding upon. It's far above us. So please just don't be upset with your regulators about these, because I know I have different opinions than what is going on, but it's not my place to have those conversations. So just everyone kind of keep that in mind.
Murphy,
Right.
the last comment I would have is just that I think it is fair to keep up on these guidelines. And, if you have a difference of opinion or a question, to ask the entity that's regulating you, by providing those guidelines, especially if they're like CDC guidelines, I think that brings up a very legitimate approach where you could say, if you're meeting those guidelines, if they're being more stringent than that, they're kind of off the page a little bit. So, do your research on that stuff. The program here can help evaluate some of that stuff as well. And
This
grab
isn't
one
just
of us.
Montana. This is.
Okay. Oh, sorry. I think in Montana, we would at least say that, the program here can help interpret that stuff. And we do find some local jurisdictions, probably in any state, that go beyond our recommendations. And in Montana, they can do that. But we usually try to make sure that they can back that up based on the science. And in some cases where they can't back that up, at least in our case, we tell them that we don't think they should do it because it makes you look foolish if you can't back it up. With that, I'll exit. Thank you.
Thanks.
Thank you. If anybody has any questions that they would like to ask, and you can either, like I said, you can either put it in the questions box, or now you can raise your hand and Amy will unmute you. So while we're waiting for that, I'll go to the next question. And this one is more aimed at, this is a California particular question. So in California, why isn't environmental health and the Department of Health working closer together? If regulations are under environmental health, however, public health is the one determining how to work during the pandemic.
Because it's a public health order, it was issued by the California Department of Public Health and the governor. So the governor issued an executive order, and the regulators within the state of California range from being in public health to being in environmental health to being a county agency to being a city agency. And that's a great question on why the body art TAC and the California Department of Public Health and the governor didn't have more interaction. But I will say that they are significantly higher up in this hierarchy of government agencies to reach out to us. And it was a very interesting time. I know that the body art TAC, we tried to help as much as we possibly could. I spent a lot of late nights and weekends trying to create guidance documents with the TAC and help however we might be able to.
Great, thanks, Candace. Does anybody else on the panel have anything to add to that? All right.
I'll just say really quick, I think a lot of industry or anybody that doesn't work for the government, it's hard to understand like the way the flow charts and the things like that. And it is different in every state and sometimes in counties. Here in Colorado, city and county of Denver has their own rules, and then there's everybody else, and we all have rules too. So it really depends a lot on how your state is organized. And yeah, I mean, us at the local level, unless we are making something more strict or we are applying for variances, which sometimes we can do, it's really like we just take direct guidance from the state.
All right. Next question is, what data from our individual counties should we be looking at to indicate when it would be safe to loosen restrictions or conversely to tighten them? Would it be the total number of positive cases per day, percentage of positive results, or something else? I'll start with Mike.
See, that I do not know, because that decision, at least in Ohio, is made from the governor's office, so I don't know.
All right, Catherine?
Just same here. Not something I would know.
Candace?
No comment. I don't know.
Anything? Okay.
Specifics, I don't know, but definitely when you're seeing an increase in the number of cases, that's going to be an indication that obviously you're trending the wrong way, which is happening in our state right now.
All right, and Jody.
So what Colorado is doing, and I mean, of course, I can't say what is correct from state to state. All I can share with you is what we are doing. Our levels are based on 3 metrics, and I like the idea of having 3 metrics because it's more of a holistic point of view instead of getting stuck on one number, since we know that, I mean, sometimes these statistics can be a little bit skewed or things like that. But what Colorado is basing their levels on, and we are going county to county at this point, it's no longer statewide like it was before. It is the number of new cases, it is the percent positivity, and it is the impact on hospitalizations. And I think that part really should be a significant determining factor, because even if your percent positivity is very high and you have new cases, if your hospitals are not being overwhelmed and they're able to have enough beds and have enough staff to man all those beds, that's probably, I think, out of the 3, one of the most significant determining factors as to which, if we're going to need to tighten restrictions or not.
Can I add to that? You know, the actual answer to this, what the state's going to do, it's kind of a political thing. So I know here in our state, our current governor is only going to be in office until January. So he's going to have a different approach than the incoming governor. Our current governor has said that he is not going to issue another stay-at-home order unless there's federal aid that's going to be given out. Like the other people said, we understand that this is people's livelihood. So if you have to shut down your shop and there's no money coming in for you, no, we understand. We don't want that to happen. So that's where we are. That's where we're at in our state. And again, we get a new governor come January. So he campaigned on advocating for personal responsibility over issuing any mandates. But then again, our state is not doing so good in the COVID. You talk about hospitals being overrun, that's happening to us right now. So whether come January, he starts pulling back all of these mask mandates and stuff like that when we're getting worse during the pandemic, you know, that's yet to be seen. But that, like Jody said, all of those things are being looked at and taken into account.
All right, great, thanks. And we did get the bandage question was from Montana. So happy to hear that the bandage requirement is on the radar.
Yeah, we understand, and it's been a topic of conversation several times. So yeah, it's probably going away.
All right. And we have 8 more minutes. So I have one more question unless somebody wants to slip one in at the last minute. Either raise your hand or type it into the questions box. So the last question is, what do you anticipate happening with an uptick in COVID numbers as far as things staying open or closing? Or is that even something that you can answer. I'll start with Catherine.
Sorry, I keep having trouble hitting the mute button. I don't really want to say anything on this because again, none of it's my decision, but I would just say look at what occurred when we were in this situation last time, and we probably all have a good guess as we continue. I know Michigan is getting just crazy numbers and with COVID, and it's just going way nuts here. So we have increased our regulations in general as far as food and body art. So if we can't get them under control, I think just common sense says that it will continue to start shrinking on our limitations of what can be open and what artists can do. But again, that's not a decision that I would be involved in making.
Candace.
No comment.
Okay. Stacy.
I kind of just answered this. It's a political question. With our incoming governor, I don't foresee him shutting down the state because that would be the opposite of what he campaigned on. But at the same time, the situation here in Montana, it's getting worse every day. Our COVID numbers are going up with all these mandates in place. So, I mean, hopefully something comes from the federal level where we get more help for small businesses and we can do a stay-at-home order. But like I said, I don't know if the governor will do that. Obviously, all of these things are above my head, and when it comes down to it, no one's going to ask me.
All right. Mike.
Yeah, I don't know either. I don't know if there's anyone from Ohio listening, but I do know that our governor now is really big on keeping businesses open if they possibly can, for like what everybody was saying. But you know, I don't want to be quoted on that, but because just as of today, Ohio or Franklin County turned purple, and like it's starting to rise too. So.
All right. And Jody.
I agree that it's a very political question. We can't really anticipate what's going to happen. You know, our governor just added another, there wasn't even purple until Monday. Red was the final level, and he added purple on Monday. And I think in hopes that, I think everybody's trying to support our economy and keep things, you know, open. And he was talking a little bit about a statewide assistance, that because if we go to red, indoor dining closes. He was talking about what's going to happen to the counties that move to red, and a statewide bill that they're passing to provide financial support to those types of businesses. You know, the goal, it should be about personal responsibility. Unfortunately, a lot of this stuff is very difficult to enforce. We don't have the capacity as health departments to walk around and peek in windows and walk up to people on the street that aren't wearing masks. We have to do the best we can to campaign and support promoting public health and safety. You know, Colorado, everybody has the opportunity to have a mitigation plan. So although across county to county, you're able to see that different counties are at different metrics. And like right now, my county is still in orange, although some of the counties that have moved to red have the same metrics as us. Every county has the opportunity to develop a mitigation plan and submit it. And then you get a certain amount of time to see if that mitigation plan will work. It really comes down to politics and personal responsibility, I think, more than anything.
All right. Great.
Can I
Thank
add
you guys
something
so
there?
much. Oh,
On that
absolutely.
note, everybody just wear your mask, wash your hands, social distance. We're in a pandemic, it's real, and although there's a 99 whatever % survival rate. Just because you live doesn't mean you won't have permanent lung damage or any damage that we don't know what's going to happen in the future because it's a new virus. So yeah, take it seriously, be responsible, whether you're at your own place of employment or out in public. And don't give the people who are trying to enforce these mandates crap, because most of them didn't write them. So be nice to the people at the door who tell you need to wear your mask, or your regulator when they come and tell you that you need to wear your mask. It's new, we're all doing this together, and just be kind and take it seriously. And
Well
that's my
said.
soapbox.
Yep.
Well said. We don't make the rules, we just work here.
All right. We are out of questions and out of time. So thank you all so much for attending, and thank you to our lovely panel. You guys were amazing. And I hope everyone has a great day.
Thank you
Thank
so
you
much.
so-
Thank you. You too.
Thank you so very much for having us.
Bye, everyone.